begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life. Now in this episode of a two-part series, I would like to discuss the similarities and differences between the flu virus and the coronavirus briefly from a Western medicine perspective, as well as from a Chinese medicine perspective. Now I've been involved in many private chat sessions regarding this topic, as many are concerned as to what happens if an individual were to become infected with both viruses. I cannot answer that question simply because we're dealing with a virus that is pretty much new to the Western medical establishment. Now, if you're ever interested in engaging in private chats regarding acupuncture and whatever ailment you or a loved one may be faced with, as well as learning more about acupuncture, Chinese herbs, Eastern nutrition, and plant enzymes, simply go to the Google Play Store and download the Acupuncture is My Life app. Now back to the discussion on similarities and differences between the flu virus and the coronavirus. Now both the flu virus and the coronavirus are both highly infectious respiratory illnesses, although they are different viruses. In some cases, it may be hard to tell which virus you may be infected with simply because they can present with similar symptoms, whereas testing may be needed to confirm a diagnosis. As the medical profession continues to learn more about this novel virus, which much remaining unknown, that being COVID-19, we're beginning to learn that there's just as many differences as there are similarities between the two. Now let's go over some symptoms between the two, and for those who have not viewed my coronavirus series, please take a moment to do so at your earliest convenience to learn more about how serious this novel virus actually is. Now they both can present with fever, cough, shortness of breath or difficulty breathing, fatigue, sore throat, runny nose, body aches, headache, vomiting, and diarrhea. Now, when it comes to differences, a major one is the speed of transmission. The flu virus has a shorter time from infection to appearance of symptoms, as well as a shorter time between cases than the coronavirus. The time between cases averages around 5 to 6 days for the coronavirus, as opposed to 3 days for the flu virus, which means that the flu can spread faster than the coronavirus. Now, symptoms as a result of infection can present as early as 24 hours for both viruses, although in most cases, it takes longer for symptoms to appear as a result of being infected with the coronavirus, although it's possible to spread the virus within 24 hours of experiencing symptoms for both. Now, the difference here is the coronavirus can be contagious for like a longer period of time, as opposed to the flu virus. Now, both viruses can spread between individuals via close contact, some say within 6 feet, and the spread of both viruses is basically via droplets as a result of cough, sneeze, or simply talking to each other. Now, both viruses have similar high-risk populations, that being older adults, people with pre-existing conditions, as well as pregnant women. Now, let's take a break from the Western medicine side of things and look at things from a Chinese medicine perspective. Now, Chinese medicine views the diseases much different than that of Western medicine. In Chinese medicine, these viruses are as a result of an acquired wind pathogen, which is considered an exterior pathogenic factor in Chinese medicine. Wind as a pathogen has a tendency to invade the upper part of the body, with focus on the lungs' defensive qi, which protects the body from exterior pathogens. Now, wind tends to cause symptoms such as aversion to cold, fever, neck stiffness, primarily in the back of the neck, with headache. And wind pathogens can come in various forms such as wind cold, wind heat, wind damp, wind dryness, and wind water. Now, I will not go over the symptoms of all of these. I will just focus on the two main ones that pertain to both the flu virus as well as the coronavirus, which are wind cold and wind heat. Now, when cold tends to present with symptoms of aversion of cold, sneezing, cough, runny nose with white mucus, fever, back of neck stiffness that aches, with no sweating or thirst. When heat tends to present with symptoms of aversion of cold, fever, sneezing, cough, runny nose with yellow mucus, back of neck stiffness that aches, sweating, sore throat, swollen tonsils, and thirst. Now in part 2, I will discuss the coronavirus as a warm disease, which in its early stage can present with symptoms of wind heat based on my experience with diagnosing COVID-19 patients via telehealth. Now in the early stages, all exterior pathogens tend to present with similar symptoms of wind cold or wind heat, which makes it difficult for some acupuncturists to determine if the patient is suffering from an invasion of wind heat or warm disease. So I simply follow a treatment principle aligned to that of treating a patient as having contracted an exterior pathogenic factor. Now, when it comes to the flu virus, which is a simple invasion of wind in Chinese medicine, it's best to treat it in its initial stages. Since it's a self-limiting disease, it tends to be much easier to treat from a practitioner of Chinese medicine standpoint, as opposed to the coronavirus as diagnosed as a warm disease, whereas an acupuncturist can potentially alleviate the symptoms to potentially shorten the course of the disease, as well as attempt to prevent potential complications. Now, if wind is allowed to penetrate into the interior of the body, it can cause a myriad of different diseases, so it's best for an acupuncturist to address wind pathogens early and not wait. Now, nothing is set in stone here, and I'm in no way advocating for one form of medicine over the other. I will continue to state that if you were to encounter symptoms of either virus, please consult with your physician. If you choose to consult with your local acupuncturist thereafter, of course, feel free to do so. Now, wind as a pathogen in Chinese medicine represents as both a causative factor as well as a pathological condition. Now, as a causative factor, the climate, or better yet, sudden changes in the weather, can overwhelm the human organism if it's unable to adapt quick enough. As a pathological condition, wind is seen as a set of symptoms which can present as wind cold or wind heat, and which I previously discussed. Now let's take a look at a case of influenza in which I treated earlier this year. The patient presented with high fever, aversion of wind. There were body aches and nasal congestion, sore throat with a desire to drink cold liquids. The patient's tongue appeared as red with a yellow coating. His symptoms supported my diagnosis of wind heat attacking the protective level. I then knew I had to release the exterior and disperse wind heat, so I needled acupuncture points on the lung channel to suppress the fever and treat the sore throat. I needled points on the large intestine and stomach channels to clear heat, as well as points on the governing vessel and Sanjiao channel to disperse wind and to release the exterior. The patient fared pretty well following his treatment, as I'd informed him to stay in touch with his physician to keep her informed as to his progress. Now in part 2 of this series, I will go deeper into the flu virus and the coronavirus from an acupuncturist's point of view. So subscribe to this channel to stay informed of new episodes, as well as download the Acupuncture is My Life app from the Google Play Store. And you can always go to my website at acupunctureismylife.com and click on Understanding Acupuncture to learn more. And until next time, acupuncture is my life. What's yours?